Suzanne Yee joins us today. We're going to talk a little bit about a procedure called CoolSculpting, and if you have a place where you just can't get rid of that body fat, that stubborn fat, this may be something you want to try. Good to see you.
Good to see you.
Yeah.
Well, as you said, we all have stubborn fat, and as we age and as gravity and genetics, it's harder to lose that stubborn fat with just diet and exercise alone. And,
right.
You know, CoolSculpting is a revolutionary contouring procedure that will freeze that stubborn fat, then your body will naturally eliminate it through the lymphatic system, and then that stubborn fat is gone for good.
Non-invasive, this isn't surgery.
No.
Right,
no,
which is one of the good things about it.
That is one of the good things.
Okay, let's talk about how it works really. How does it, you know, freeze your fat, and then what happens to the fat? And I think we've got some video to help us.
Yes, we do. We have an applicator. We place it on the area concerned. It will freeze the fat, and actually fat freezes faster than any of the other cells. So it targets fat cells only and leaves the skin, the blood vessels, the nerves intact and not harmed at all.
Just going after the fat.
It just goes after the fat, and that fat that is frozen is then eliminated through the body over a period of, say, 2 to 3 months. So it's a slow, gradual process, and that fat layer will shrink, and then that area of bulge will decrease in size.
Yeah.
So it's a great procedure for the person that doesn't want to have any type of surgical downtime.
That's right. Let's talk a little bit about how many treatments do you need. Is it different for everybody?
Yes. You know, CoolSculpting is a non-invasive procedure, and so we have had the procedure for a little while, but as with any new technology, it has gone through some transformation for different protocols, and so we have an advanced protocol, and we have everybody's different, so we've come up with a treatment to transformation plan to address those areas of concern. And that has made our results even better.
So for some people it may take more than once, for some it may not.
Right. So with the treatment to transformation program, we may have extra areas of that we will treat in the area to optimize results, or may have additional treatments to optimize those results.
Okay. What areas are we talking about? Because I think everybody's thinking, okay, would this work on my arms? Would it work on the tummy? Where would this work?
Well, we do use it on the tummy. We use it on those love handles, the arms. We've used it on the lateral thighs. So we can use it on multiple areas, but it does need to be pinchable fat that we can actually have suck into the applicator that we place on the area of concern.
Okay, and then you just kind of sit there with it, with that applicator on you for a while, right? Okay, let's talk a little bit about the transformation we can see, and we have some before and afters here.
Actually, those are the flanks. That's actually my husband's.
It is? Did he? Okay, I guess he gave you permission.
Yes, he did. He'll die if I say.
He looks great.
But really, actually, you know, he's not a big person, but he has those 2 little spots that he needed to get rid of.
Yeah.
And he just came in the office, and we just did that. Crazy.
Thank you for being a part of it.
The abdomen, great results. And this is what the treatment to transformation protocol, where we're having to actually do more than one treatment.
Yeah.
But those additional treatments actually have made a huge difference in our results.
Yeah, I mean, I can see it even toning her up in other areas, you know, like her waistline.
Yeah, and I think it helps people get a little bit motivated too. And they see that one area that's getting better, then they motivate themselves to exercise and continue on.
Okay, and then you mentioned, have some people done it on their arms as well?
Some people have done it on their arms, and they're coming out with new applicators for areas that are non-pinchable fat, so that's coming out pretty soon too. Some of those hard to treat areas such as the knees and things like that.
More and more all the time. Let's talk a little bit about who would benefit, who's the best client or patient for this?
Well, it's great for the person on the go, the busy mom, the person who's busy in the workforce, maybe even that busy bride that's trying to get ready for the summer, but the person that can't have time off for surgery or don't want to have time off for surgery, that's a great candidate for.
And not really someone who is really overweight. It's not going to be for them, right?
No, you really need to be in fairly good shape. It's areas that we can just like pinch up, and we can treat those targeted areas. Anyone that's really overweight, I would not recommend this for.
Yeah, it's going to take some other procedures or diet plan for that. Okay, tell everybody sort of how the process is to get started on this.
Okay, just call our office. We'll set up a consultation. We'll show you whether you're a great candidate or not, mark the areas that we consider that would be good, and then tell you the treatment plan that we think would be best for you.
Okay, and then you probably come back on a different day to have it done.
Yes, you can come back on a different day and have it done. It takes about an hour per applicator.
Okay.
So depending on how many applicators are used will depend on how long you're there. But you can sit on your iPhone, you can work on your iPad or computer while you're having it done. It's pretty easy.
Yeah, you're just kind of sitting there letting the machine do the work, which is great. Okay, Cosmetic and Laser Surgery Center, of course, that's Dr. Yee's place over on Cantrell. There's the phone number for more information. You can also go to the website and see lots of before and afters on not this procedure, but almost everything that is offered there at the Cosmetic and Laser Surgery Center. Thank you, Dr. Yee. Swimsuit season, so I know we'll see plenty of you coming up in the next week. That's right. All right, back in just a moment. And thanks to your husband for sharing his picture, too.